A weak jawline or chin is a question, how can I've got this problem, and this is about facial profiling. So genetically, we're all different, and in some races, a weak chin and jawline is part of their genetic makeup. So some of the Asian patients that we see. However, for a lot of patients that we see, it's not a genetic thing, other than the fact that they're born sometimes with a short jaw, okay? And that can be anterior. So this is where the chin is not projecting in the same way. And so we can alter that jawline profile by augmenting the chin. And that's called chin augmentation. We tend to do that with a filler. It could be a hyaluronic acid filler or a long-acting collagen stimulating filler. Surgeons might do it with a permanent implant underneath the chin muscle to push it forward. But we prefer to use a filler because it's safer. It can be repeated if needed, and gives long-lasting results. And that can almost instantly give you a sort of more contoured jawline, creating that more V-shaped face. And it can even help with the laxity that you might be seeing, which is associated with a short jawline in the upper neck. So we call that jawline contouring or jawline profiling. We can also place filler more posterior along the jawline, and we can augment the bone along there to give a more defined jawline. That tends to be more affected by the aging process, so that might be our more older patients. In men, they might have a weak jawline, and they have maybe a more feminine jawline, and typically men have a much wider, stronger jawline, a wider, stronger chin. So if we want to make them appear more masculine, then we can actually literally place that filler in certain strategic places to augment the chin and the jawline to be more masculine.